Hi everyone, thank you all so much for joining us this afternoon for the Delta Hospital Town Hall meeting. My name is Nicholas Wong, and I am the Secretary and Media Liaison for Friends of Delta Hospital. And it is my distinct privilege today to be your MC. Now, before we begin, I would like to pay my respect to the Tsawwassen and Musqueam First Nation, on whose traditional lands we are all standing. Now, may the Most High bless this gathering. The Friends of Delta Hospital is a volunteer healthcare advocacy group that was formed around the surgical program at Delta Hospital. And it is for that reason that we are here today. Delta Hospital is near and dear to my heart, and I am sure that you all feel the same way, or you wouldn't be giving up your Valentine's Day afternoon to be here. And a big thank you to the significant others of everyone. I'm sure you all make it up later this evening. The hospital is one of the most iconic landmarks in Delta, and we appreciate the fine work being done by the doctors and staff. I know that when I go there, I will receive the best possible care. Now today, we will explain to you why it is so important to expand the surgical capabilities of Delta and how doing so will build on our excellent services for generations to come.
When 30 doctors send a letter to a Minister of Health and say that, in their opinion, equitable health care is compromised in this community, I think people have to sit up and listen. When 60 doctors sign a similar letter a month later saying that the health care in Delta is not equitable to other parts of the province and that we have a problem in our surgical care capacity, we have to sit up and take note. And everything that's gone on in the last couple of months has been an attempt to force the system to take note of the issues that have been brought to light by our medical staff here. All I can say is that pressure is the only thing that is going to change this system, and that we have realized. So, over the last couple of months, you'll have heard many of us on the media. You'll have heard me in question period asking the minister questions, sending letters to the minister saying, will he meet with the doctors and follow up on the letter of concern with them. As late as last week, I sent another letter on behalf of Friends of Delta Hospital and spoke with Terry Lake, the minister, asking him if he couldn't see himself free to meet with the doctors, would he at least meet with the citizens, the Friends of Delta Hospital? Hopefully there'll be an answer to that. Hopefully there will be a change in position. Meanwhile, it is absolutely thrilling to see everybody out here supporting the Friends of Delta Hospital and supporting the concern that our doctors have indicated to the ministry and to Fraser Health. We have to make the corrections that will give our hospital the full complement of services we know we need. And I thank you for coming and for supporting the doctors and for helping us create a zone of pressure that can't be ignored throughout the province. Thank you so much.
Delta Hospital really, along with many of the schools in our community, really it has a vibrancy. It really is a heart and soul. And I have nothing but respect for the hardworking staff at Delta Hospital, the volunteers. Without them, this hospital would be nowhere. If you take, and I know Doug's going to give us a history lesson in a little while, but you take that hospital back many years, the farmers of this community donated the land, the bricks and mortar, and it's become quite substantial. And I also recall the days, it was actually before I was on Delta Council, but the days when that hospital, and a lot of people keep reminiscing about the emergency ward, but if you think back far enough, there was a day when they wanted to close the entire hospital. You might recall that. And it was through the hard work and the tenacity of the people in this community that kept that hospital open. It has become a jewel. I think we need to properly define what it is where we're trying to go. I think it's very easy to suggest we just, we want it all back, but we need to have discussions. We need to continue on having proper dialogue with the right people.
I'm here on behalf of Judy Darcy, as Vicki has already mentioned, And so my role here as the critic for mental health and addictions is, and here on behalf of Judy, is to do a lot of listening, which I intend to do. But I do want to support and reiterate Vicky's position that the way to get through this is through pressure and through political activism. If you have something that is important to you, you have to be active as a community to have politicians hear your voice and hear it strongly. And I think Delta is, as Scott had says, so fortunate to have a group of people that call themselves the Friends of Delta Hospital and have been so extremely active in the past supporting good health care in this community. So I'm here to support you, to listen, and hopefully when that's finished, we'll have a few words. Thank you.
Some 87 years ago, in 1918, well before the George Massey Tunnel, there was an influenza epidemic in BC. Dr. King, along with 5 nurses and volunteers from the community, set up a hospital on the 2nd floor of the McNeely boarding house in Ladner. As the Royal Columbian Hospital was overflowing, doesn't that reflect the problem we have today? And 14 residents died during that epidemic, with one of the nurses as well. In 1936, when I came to Ladner with my father, George Massey, my birth mother, Doris, and my sister, Doreen, my mother was badly burned and in excruciating pain and had to be rushed to a hospital. There was no ambulance. So Dr. King tore out the back seat of Scott Fenton's car, took the crib mattress from her house and laid it in the back of Scott Fenton's police car, commandeered the Ladner ferry, and took her to Vancouver General, where she was to die 5 days later. Then in 1967, a campaign started by Walter Vassar, Robert Reynolds, the son of Hugh Reynolds, Ian Payton Sr., many other volunteers to fix a site for a hospital in Delta. Guess what? They were opposed by the regional health authority at the time, who felt despite our isolation, we were well enough served by the existing hospitals. Does that sound familiar to you? We had the highest mortality rate in the lower mainland. I think it was 30%, because we could not get to a hospital soon enough. Dr. Kinney's 1968 definition: you cannot call it a hospital unless it has 24/7 surgical program complete with an intensive care unit. Without those, you have nothing but an oversized medical center. We must rise up again and convince the provincial government that their centralization policy has not worked, to give us back our hospital with its surgical program and ICU, before we rank once again with the highest mortality rate in the Lower Mainland. Thank you.
But we provided all the meat and potato care that any community would ever need. The first problems, as Doug mentioned in his great history of the hospital, happened back in 2002 when the Fraser Health, under huge budgetary constraints, decided to make the cuts and change the hospital to subacute, remove the acute surgical services, the ICU, and indeed the hospital was in danger of folding. And if not for the pressure from this community, I have no doubt it would be gone. Now, the Fraser Health, to their credit, has slowly done a little bit to get things going. Back in 2006, they built the new ER, which was a huge asset to the community, seeing about 33,000 patients' emergency visits a year. And then in 2008, they eliminated that horrible title subacute and restored it to an acute medical hospital. They restored the medical wards to acute medicine, and they actually threw a bone to the operating rooms and added a 3rd OR, which we've been pressuring for a long time. Unfortunately, they stopped there and never went and restored the surgical ward to the hospital. Operating rooms cost $1.2 million to run, we should get $1.2 million for every operating room at Delta Hospital. There's no logical reason why not.
This is when you come to a meeting like this, it's quite nice to see how involved this community is, and that's what keeps our community so vibrant and so alive. I've been in this community for over 21 years. I came to the Delta Hospital as my first job as a surgeon. I've stayed here. I love it here. We live here and do all of the things we need to do right here. The hospital's changed over the years, as you all know. When I first came here, we did a larger range of some operations and a larger range of some medicine, but in smaller volumes. So things have changed. Not everything is bad. There's a lot of good things happening at Delta Hospital. We're doing larger volumes on a daily basis. We started, when I came here, we had 1.5 to 2 operating rooms, and now we have 3 full operating rooms working 5 days a week and a full scope room. So we're doing volumes that are increased. Unfortunately, some bad things have happened over the years, and things that without this community, we wouldn't even have a hospital, I have to say. But we lost certain things. We lost our nighttime surgery, we lost our weekend surgery. We've lost certain things that make it a little more difficult to manage and put us all in a little bit more of a precarious position in managing day-to-day activities.
3 major points. I think number 1, Delta is a great hospital. Number 2, Delta is being vastly underserved by the health ministry. And number 3, it wouldn't take much to correct it. We sent a letter to the minister back in October because, talking to my colleagues, they expressed to me that they were very concerned about the surgical program at Delta. So we sent a letter to the minister with 35 names. We have now 50 names on the letter now, and to tell him our concerns. I think the bottom line is I think people need to realize that the residents of Delta are being vastly underserved in terms of surgical services. We're 6.25% of the population at Fraser Health, and we're receiving 1% of the funding from Fraser Health. I went back and looked at the 2011 census, and if you looked at the top 10 or 15 municipalities in BC, Langley has 166 beds, Delta has 60 beds. So we'll move down further. Kamloops has 240 beds. North and West Vancouver together have 268 beds. Victoria, where the ministry is, has 844 beds. So like Dr. Siegel said, you can go anywhere in BC, from Cowichan to Cranbrook, from Fort St. John to Langley. You could get, they all have surgical beds, and we have none. So our proposal is to ask the minister to release funds to have 4 inpatient surgical beds. I think that would be a very positive first step towards restoring full surgical care at Delta Hospital. But then we were told, well, there's no money. So, but if you looked at the Fraser Health budget for the next 3 years, again, we run Delta Hospital at about $30 million a year. The surgery department runs at about $3 million a year. We're asking for $1 to $2 million more per year operating budget. The Fraser Health corporate budget is $200 million a year. And they're giving themselves a $50 million increase in the next 2 years to $250 million a year. Now, if they could keep $48 million of that and just give us $2 million, then we could provide acute surgical services for 120,000 people at Delta. It's just inconceivable that we're in Metro Vancouver, we have 120,000 people, and we have no access to acute surgical care. But we heard for the second time yesterday from Fraser Health official that their suggestion was that the residents of Delta should self-assess themselves before coming to the hospital. They said that if you know that you have a surgical problem after 3 or 4 o'clock, you should know to drive yourself to another hospital. So they've said it twice now. The first time we didn't quite believe it, but then they said it again, and now it's on the official transcript. And so we'll be asking Fraser Health to provide us with a self-assessment card, a tool, so that we can use it to assess ourselves before deciding which hospital to go to. So anyway, we're here to answer your questions. Thank you.
There was a knock on our bedroom door at 5 o'clock in the morning. My mother, who has dementia, and that would be interesting for her to have filled out a self-assessment tool, knocked on the door at 5 a.m. She'd been suffering for the last 2 hours with the most excruciating pain, had crawled her way to our bedroom door to say she thought she was about to have a heart attack. So we called 911, and BC Ambulance was very, very prompt. They were excellent. But trying to help determine where the source of the pain is with a patient with dementia. Has anybody had experience with people with dementia? So you understand how difficult that is to really understand whether it's a heart attack, whether it's a bowel, whether it's appendicitis. So we whisked her off to Delta Hospital, and that was probably, we were there at about 5 o'clock, 5:45 in the morning. With the various different issues that we were dealing with, it was 8 hours at Delta Hospital, and she was on painkillers. She'd been poked and prodded, she said, as much as she possibly could be. And they felt that because of her history of having a heart issue, they didn't want her to have a heart attack while she was on the operating table. They had found that her bowel had twisted, and that was the source of the excruciating pain. So we were told by the Delta staff, and they were just amazing staff, so patient with us. So I have to say that our experience with Delta Hospital is absolutely wonderful. I'm very, very pleased to be able to speak to you about how much I love this hospital. It is the mainstay of why we can live here in peace and understand that there is something here that is worth saving, that is worth fighting for, that is worth coming here on Valentine's Day to talk about how wonderful it is and how much we need to fight for it.
Bigger is not better. Sometimes you'll have a small hospital that does a better job of the bigger hospitals because it has a more contained and more intimate atmosphere. So all I can say to you is I will take your thoughts and your concerns back to Judy. We'll work with Vicki in the House, and we'll work with Scott to make sure that your voices are heard. Thank you.
Our doctors and nurses do an amazing job and truly care about their patients. And this is why Delta Hospital has the highest patient satisfaction rating. They do such a great job, in fact, that all of you, they came out today to make a statement and to take a stand for the hospital. On the back of the fact sheet, which are available in the back, you'll find the Health Minister, Terry Lake's contact information. I suggest that you all take it upon yourselves to make yourself known. Send a little letter and make sure that way over in Victoria in his office, he knows that Delta has a voice and that Delta will not be quiet. Thank you all so much for coming out this afternoon, and never forget that together we can make a difference.